Hello. A quick class on Sandi's medicines, which are numerous. Over here we have her daily regular stuff, and pretty much everything else is PRN as needed. So this is essential. The pill minder, gotta have it. I also have a laptop where I keep a little unofficial MAR medication administration report for myself, so I don't over medicate her. This is the stuff that she has daily. Let's see, omeprazole 20 milligrams. That's Prilosec for GERD. Aspirin 81 milligrams. That's baby aspirin. That's to prevent blood clots and heart attacks, because she has a cardiac history. Metoprolol is a beta blocker, beta adrenergic blocking agent. Stops epinephrine from constricting your blood vessels and increasing your blood pressure. Keeps your blood pressure down. Treats hypertension. Duloxetine, which is Cymbalta, 30 milligrams. That's for depression. Not working too good. Zolpidem tartrate, that's Ambien. She takes 10 milligrams, and about an hour after she takes that, she doesn't even know her own name. Works really good. Duloxetine. Where did I mess up? Oh, I have an extra duloxetine. That's an old one. Put that out of the way. PRN stuff as needed. We got benzonatate, which is Tessalon pearls. That's for cough. Works very well. 100 milligrams. She'll take 200 milligrams. Uses that occasionally. Lorazepam for anxiety. That's Ativan, generic, 1 milligram. Works very well for anxiety. Respiratory patients all have a lot of anxiety. Acetaminophen 325 milligrams for minor pain. She has a lot of muscular, I guess they're like spasms that bother her, so that's for minor pain. Loratadine 10 milligrams. That's Claritin. She can take one of these every day for snot. She's got a lot of runny nose issues, rhinitis. Also, you got a suppository for NNV, nausea, vomiting. Prochlorper, 25 milligrams. Haven't had to administer these yet. Thank you, Jesus. Okay, all this stuff right here came out of her E-kit, her Agape Hospice Emergency Kit. And the star of this show is the morphine. We got morphine sulfate. You administer between 0.25 and 1 milliliter with this tiny little syringe. Okay, no more than that. By mouth or sublingual every 2 to 4 hours as needed for pain. This is for the worst pain, lung pain. She hasn't needed this yet, so I'm saving that for me. Just kidding. Another suppository, Bezac Evac. This is 10 milligrams for constipation. So the other one was nausea, vomiting. This is for constipation. Hope I don't have to use those either. Here's another suppository. This is 850 milligram acetaminophen, Tylenol. Tylenol bombers in case she had too much nausea and vomiting, and we had to treat her pain or fever. But this is, we haven't needed this. Hyoscyamine sublingual, 0.125 milligrams, tiny little pills. This is for GI symptoms like colitis or irritable bowel, which Sandi has some of that, but it hasn't been a problem lately, so we haven't used any of these. Here's another thing for nausea vomiting. This is promethazine 25 milligrams. Nausea vomiting, none of that yet. And oh, here's another star. This is haloperidol, which is Haldol, 1 milligram. Comes in these little weird syringes, and this is also for anxiety or agitation. This is the big bomber. Lorazepam, the Ativan, is for a little bit of anxiety. This is for when you're freaking out and short of breath. Haven't used those yet either. I forgot the albuterol nebulizer. These are little plastic dealies that you break off and snap and put in her nebulizer, and you give her what is the amount? Oh, 2.5 milligrams in 3 milliliters of saline. So I do this 4 times a day. Normally, the pulmonologist says this is not effective for interstitial lung disease. It's for COPD and asthma. You know, things where your bronchioles are constricted and you want to dilate them. That does nothing to fix the interstitial problem between her alveoli and her blood vessels, the actual gas exchange membrane. But the hospice nurse said try it anyway. We did, and it seems to be helping. So we're doing that 4 times a day. Last thing is the guaiacin. This is guaifenesin, an expectorant for her cough, for her dry cough, and codeine. And you administer this with a little 10 milliliter syringe too. So all this crap for Sandi, and she takes a good bit of it every day. So I just wanted to let you guys know what she was taking, in case you had any questions. Okay, bye.